All right. Well, hello, everyone. Thank you. I'd like to welcome everyone to this webinar. We can get started. So this is the latest edition of the webinar series of the Homeland Security Research Division, or HSRD. As you may know, this is a regular series in which we invite notable practitioners and scholars in Homeland Security and related fields to share their insights and experiences. My name is Jason Barnowski. I'm one of the Associate Program Directors within HSRD's Disaster Management and Resilience Program, and I'll be moderating today's event. So we're thrilled to welcome today Andrew Parker and Rachel Steratore to discuss their recent work on the National Test of the Wireless Emergency Alert System, or WEA. For those of you who have had the pleasure to work with Andy and Rachel, Andy Parker is a senior behavioral and social scientist here at RAND. He's worked on a wide range of projects for us, from topics such as risk perception in domains ranging from emergency preparedness to community resilience, climate change, and psychological health, and projects addressing vaccination, mental health, and a wide variety of other issues. Rachel Steratore is a policy researcher with expertise at the intersection of extreme event climate attribution and social and behavioral science. She works with quantitative and qualitative methods on topics ranging from weather and climate-related risks to anti-terrorism technologies. Before I turn to our speakers, I'd like to offer a quick word on our format today. So first, please note that this webinar will be recorded and posted. Andy and Rachel will be speaking for about 35 to 40 minutes. Once they're done, I'll kick off the discussion with a few questions before taking questions from the audience. So please feel free to put questions in the Q&A function, and I can ask them on your behalf. So with that, let's please welcome Andrew Parker and Rachel Steratore.
Thank you, Jason. Good day, everyone. Thanks for joining us. The U.S. uses a complex set of tools to alert the public to urgent situations. These are run by federal, state, and local agencies, as well as private companies. At the federal level, the Integrated Public Alert and Warning System, or IPAWS, includes a range of components. One of those, the Wireless Emergency Alert System, or WEA, is a national public warning system that targets and localizes alerts to mobile devices in specific geographic areas. WEA uses cell broadcast technology to send messages via cell towers specifically to cell phones within the immediate impact area. Unlike SMS, cell broadcast technology uses a distinct data channel that allows the messages to be geo-targeted. And because alerts are one-way broadcasts, this reduces the risk of network congestion during emergencies. Recent changes to the WEA system have sought to improve its effectiveness at reaching intended recipients in a timely and targeted manner. Furthermore, the increasing rate of mass emergencies in the U.S., including natural disasters, drives home the importance of emergency alerting. Previous studies have sought to evaluate how well the WEA system reaches populations with different demographic and disability characteristics, income, age, urbanicity, and among other factors. Yet before this study, no comprehensive systematic effort had been made to collect data on alert receipt or other key performance parameters after a live national test of the WEA system. For this study, IPAWS engaged the Homeland Security Operational Analysis Center at RAND to assess the U.S. public's experience with the 2023 nationwide WEA test. Our research, presented here, summarizes how well the public received the test alert based on a nationally representative survey immediately following the alert. The overall objective of this project was to understand the public's experience with WEA, and specifically the rate of receipt and how this varies by technical factors such as geography, carrier, and phone, and non-technical factors such as demographics. Secondary outcomes included awareness of the WEA system and opting out behavior. For these latter outcomes, we also examined how they vary by contextual factors such as experience with natural hazards and past alerting. This presentation focuses on the main questions primarily, touching more lightly on some of these latter issues. We'll first describe briefly details of the survey administration, including the sample and fielding period. We'll then step through the three main outcomes. First, receipt of the national test alert. Second, awareness of the system prior to that alert. And third, whether people have opted out of any type of alert, as well as what factors are most related to each of these. Finally, we'll discuss policy implications of the results, and we'll end with a Q&A session. So please drop your questions in the Q&A box. Let's start out with a little bit of background about the survey administration. The IPAWS National Periodic Test fielded on WEA, as well as other IPAWS components, at 2:20 p.m. Eastern, October 4th, 2023. It was broadcast for 30 minutes. The survey was fielded at approximately 3 p.m., 10 minutes after the close of the test. This immediate fielding was desired to minimize memory effects in responding. We also used web-based surveys, as this was the only feasible means to disseminate such a large survey so quickly. The survey was scheduled to be in the field for 7 days. Eligibility for the survey included being at least age 18 and having a working cell phone as defined by the respondent. Because a key goal was to understand geographic variation, a very large sample was sought. This necessitated using 6 survey panels. These are collections of pre-recruited individuals who regularly respond to surveys for pay. Our preference was to use so-called probability panels. These are panels where individuals are selected randomly and asked to join the panel. These are known to better reflect the US population as a whole. Unfortunately, using all available probability panels only got us to about 40,000 respondents. We approximately matched this number using a company that contracts with and aggregates non-probability or opt-in panels. These are panels where people volunteer and they're known to represent the US a bit less well. That said, these panels are much cheaper and easier to run, so the available sample is much larger, presumably in the millions. We used one such panel aggregator, not only to get increased sample, but also to oversample some key areas. First, those that are non-metro or more rural, and secondly, areas that have higher indigenous concentration, defined either in terms of land area or population. Finally, because these panels do not have much representation in the Caribbean, we contracted with a small Caribbean panel to try to get more responses from Puerto Rico and the US Virgin Islands, the 2 territories where WEA is operational. Finally, because no sample perfectly represents the target population, in this case, US adults with a working cell phone, we use sampling weights to produce population estimates. In the end, our sample consisted of a bit over 80,000 respondents from across the US. This graph shows the accumulation of survey responses over time. The black line is the overall sample. The gray lines are individual panels. As you can see, we collected data very fast. We had collected 56% of our sample within 9 hours. That's midnight of that same day. We had collected 92% within 3 days. Now I'm going to turn to our primary outcome of interest. This was whether or not the individual reported receiving the national test alert. Here you can see the breakout of all response options. An estimated 91% of US adults with working cell phones received the alert. Because of the application of sampling weights, as I mentioned earlier, this is a national estimate, not just a sample statistic. The vast majority of these people reported receiving the longer 360 character format rather than the shorter 90 character format alert. The longer formats typically are displayed on newer and smartphones, whereas the 90 characters are typically on older or feature or flip phones. Just 5% reported not receiving the alert, and an additional 4% did not know if they'd received the alert or not. We saw substantial geographic variation in alert receipt rate, ranging from 71% through 97%. There does not appear to be any obvious pattern to this variation, but subsequent analysis look at factors such as cell coverage, which may limit receipt, historical alerting, which may help with familiarity, and social vulnerability, which may limit resources such as access to newer phones or improved cell infrastructure. A few notes here on our analytic approach. We wanted to know what factors were most consistently associated with receipt. You can see here the factors we considered broken up into 3 broad categories. The first were device characteristics, essentially carrier, phone brand, and WEA capability. The latter refers to which WEA standard the phone adheres to, WEA 1.0, 2.0, or 3.0, whereas you progress, there are increasingly more features. The second set were respondent characteristics, which includes a range of demographic characteristics and whether they got their mobile device through a subsidy program like Lifeline. The third are community characteristics, including risks for various natural hazards, relative rurality, whether the area was had relatively high concentration in indigenous population or land, local carrier coverage, FEMA region, and historical experience with WEA alerts. Importantly, these community characteristics were gathered from external sources, not the survey itself, and merged in at the county level. We considered all of these factors simultaneously using a statistical technique called logistic regression to see which factors were most important. As I move forward, you'll see these results depicted in graphs like the one on the right. The plot maps odds ratios associated with each factor. For now, don't worry about the technical definitions, but note that an odds ratio of 1 means no effect, essentially even odds. Odds ratios greater than 1 to the right of the center line are factors that increase receipt. Odds ratios less than 1 to the left of the line are factors that decrease receipt. To make things easy, statistically significant effects are in black. Non-significant results are in gray. Given our limited time, I'm only going to highlight a few of the more interesting results. All the gory details can be found in the report. So let's first consider characteristics of the device. Among the three major carriers, compared to Verizon, consumers of AT&T and T-Mobile Sprint had significantly greater odds of reporting receiving the alert. This can be seen in the top panel, noting that the black bars for AT&T and T-Mobile Sprint are entirely to the right of the center line. Turning to phone brand, owners of the most common brands reported similar receipt rates. There really were no major differences. But owners of less common phone brands had lower odds of alert receipt, specifically when compared to Apple iPhone owners, the most common phone brand. Receipt rate increased across phone WEA capability, with WEA 3.0 phone owners having the highest odds of reporting receiving the alert. This may be a diminishing concern, however, as the proportion of WEA 1.0 phones is likely to diminish with time. It was only 2.2% in our survey. Perhaps most remarkable about respondent characteristics was that demographics, by and large, did not appear to be associated with receipt. This is notable, since with such a large sample, we have a lot of statistical power to detect effects. So, for example, we found very little evidence that receipt was lower for specific types of disability, for non-English speakers, or for those with lower income. So by and large, this was a reassuring result. The one factor that was significantly associated with receipt was age, with older adults reporting substantially lower odds of receipt. Note that this isn't entirely explained by owning older phones, as that was controlled for in the analysis. Turning to community characteristics, the one notable factor was rurality. As communities got more and more rural, odds of reporting receipt got lower and lower, to the point that those in the smallest communities on average had half the odds of those in the largest communities. Our second outcome of interest was whether people were aware of WEA prior to the national test. Specifically, the question on the survey asked, prior to this test alert, had you ever heard of wireless emergency alerts, or WEA? 2/3 said yes, 27.7% said no, and 5.6% said that they didn't know. So in other words, WEA is widely known, but there are still substantial gaps. As with receipt, awareness varies substantially across the US. Awareness generally ranges from less than 50% through well over 80%. We can see lower awareness in some areas in the South, but also speckled throughout the country. Turning to the predictors of awareness. Compared to owners of other brands of phones, Apple iPhone owners had significantly lower awareness of WEA prior to the national test. This could result from differential communication, or how WEA is represented in iOS, the operating system for Apple phones. Those with phones with more advanced WEA capabilities, which generally include newer and higher featured phones, were more likely to report having heard of WEA. This could be due to the features of the phones themselves, but could also be due to the interests of the phone owners. A number of demographic factors were significantly associated with awareness. I'll highlight 4 of those. First, age had a U-shaped relationship, with middle-aged adults having higher awareness than either younger or older adults. Second, those with specific disabilities, specifically those with hearing-related disabilities, were less likely to be aware of WEA, whereas those with emotional disabilities were more likely to be aware of WEA. Third, those from Spanish-speaking homes were less likely to be aware of WEA prior to the national test compared to those from English-speaking homes. And finally, there were racial and ethnic differences. Hispanics reported lower awareness than non-Hispanics, similarly for Asians, whereas whites reported higher awareness than non-whites. All of these effects speak to the potential for targeted communication regarding the system and its value. Finally, a number of community characteristics were not strongly associated with WEA awareness, including whether a community faces greater threat from various natural hazards like flooding or hurricane. Similarly, the number of historical WEA alerts in the area, the relative urbanity or rurality of the community, and if the community has higher concentration of indigenous population or land. Controlling for all of this, FEMA region was statistically significant, with region 6 largely standing out for lower awareness. This includes Texas and surrounding states. Again, targeted communication may be helpful here. As we'll see in the next section, this is mirrored by trends in opting out. With that, I'll turn over to Rachel Steratore, who will lead the rest of the presentation.
Thank you, Andy. And we'll turn our attention now to our final outcome of interest, opt-out behavior. And this is some of the very interesting and exciting and maybe eye-popping results. So here we're showing that for opting out, we asked survey respondents, is your primary cell phone opted out of any type of emergency alerts? These alerts may include amber or severe weather alerts. And if they said yes, we followed up with a question on sort of a please check all that apply that you may have been opted out of. As you can see, overall 17.5% said that they had opted out of one or more types of WEA alerts. 6.7% said they did not know or did not answer the question. So in summary of that, this is more than 1 in 6 adults with a working cell phone reporting opting out of some aspect of the WEA system. Next slide, Andy. Here we're showing how opting out of any type varies geographically. I'm presenting it by state as this appeared to be the more informative breakdown for this particular outcome, since some alerting practices vary by state. What immediately jumps out to you is Texas, which has by far the highest rate of opting out, with almost 30% of folks opting out in some way. This is more than 6 times the rate that we're seeing in some other states. Another thing that jumps out is that several of these states, Texas, Georgia, New Mexico, have historically sent Amber Alerts statewide. So we could imagine how fatigue may be an issue. For statewide Amber Alerts, they might be seen as more of a nuisance in a large state like Texas, where the driving distance from Texarkana to El Paso is about 812 miles. This is roughly equivalent to the distance from Portland, Maine to Raleigh, North Carolina. So you can imagine getting Amber Alerts, you're living in Portland, and it's talking about an area in Raleigh. It's just such a large distance. On the other end of the opting out, and for context, places like New Hampshire, Maine that are on here, Wyoming, all have opt-out rates that are under 5%, as I said, compared to that almost 30% opt-out rate that we're seeing for Texas. Next slide. So this table breaks out the types of reported opt-outs for the top 10 states. You can clearly see how Amber is dominating, often being 2 or even 3 times the rate of these other alert types. But let's look at this side by side with other alert types in the next slide to show it at more of a summary level. The list of options for opting out shown here reflect terms used by both iOS and Android systems. So out of the entire population, just over 11% had opted out of Amber Alerts. That's by far the most common, followed by 3 options that we lump under imminent threat. Emergency alerts, which is the language used by iOS. Extreme and severe threats is used by Android. And this rolls all up into imminent threat. And a decent number you can also recognize didn't remember what specific type they had opted out of, but nonetheless said that they recalled opting out of some part of the WEA system. Next slide. So here we're showing in terms of device characteristics. So these are parallel plots to what you had seen for our other outcomes of interest for awareness and receipt. Reported opting out was lower among Verizon customers than for the other carriers. Apple owners, on the other hand, reported a systematically higher opt-out rate than for most of the other major brands. One thought here is that this could be a result of iOS providing a settings button on the WEA screen, making it just that much easier to opt out whenever you do receive an alert. Next slide, Andy. As with awareness, we're showing the demographic factors that were associated with opting out. So just to highlight some of those, it was less common among older adults to opt out, who may be either more accepting of WEA or maybe less comfortable with changing the settings. It was also less common among those with self-reported physical disabilities, but more common to opt out from those with self-reported cognitive disabilities. Those with the highest household incomes were also more likely to report opting out. Lastly, those with subsidized phones were more likely to have opted out of some type of the WEA system. Next slide. Finally, and perhaps most dramatically, we see regional effects as well for opting out. In line with the map I showed earlier, respondents in Region 6, which again contains Texas, had significantly higher opt-out rates. We also see that areas with higher historical rates of Amber Alerts were more likely to report having opted out. Combined with the statewide Amber sent in Texas, this is consistent with potential alert fatigue and the also potential dangers of over alerting. Next slide. So now we've talked about our 3 outcomes of interest, and we wanted to spend some time today discussing the policy implications of some of our work that's in much more detail in the report, but we want to try to highlight some of them here for you today. Next slide. While 91% of US adults with working cell phones received the emergency alert or the test alert, gaps remain, particularly among smaller market carrier users, older adults, and rural residents. Receipt rates were systematically lower for consumers outside the 3 Tier 1 carriers for older adults and those in rural areas, indicating that these groups are at somewhat of a disadvantage when it comes to access to the system. One recommendation that comes to mind is IPAWS might investigate the specific challenges faced by older adults and rural residents in particular. Also consider interventions tailored to improve alert receipt among these underserved groups. Also, they could collaborate with carriers, especially those in less urban areas, to enhance the reach and effectiveness of emergency alerting. Next slide. So thinking back to awareness, while most respondents had heard of WEA, some areas had less than 50% awareness, indicating that there's significant geographic variation. There is a specific awareness gap among Apple users that needs to be addressed. These notable differences suggest that, the targeted communication strategy might work, knowing that this group had bigger awareness gaps than other groups, controlling for all of the things that we've shown you today. Some recommendations for improvement: establishing a consumer-oriented web presence linked to FEMA to provide a clear and accessible information platform about WEA. Implementing outreach efforts in areas with lower awareness to ensure broad geographic coverage, and working with Apple to enhance awareness amongst its user base. And lastly, designing and executing awareness campaigns aimed at key demographic groups to close some of those awareness gaps that we found in this study. Next slide, please. Okay, and as a reminder, 1 in 6 respondents reported opting out of at least one type of WEA alert, which has significant public safety implications. Opt-out rates were 5-6 times higher in places like Texas compared to Vermont, indicating a need to understand the social and policy drivers behind this variation. Apple users had a notably higher opt-out rate, suggesting that differences in implementation and communication should be examined. As far as some recommendations, IPAWS and FCC might work with Apple to improve opt-out implementation and communication, and further investigate the factors that are contributing to high opt-out rates among younger adults and those with subsidized phones, to develop targeted strategies for reducing those opt-outs. Next slide, Andy. Amber Alerts, which are essential for informing the public about missing children, were the most commonly opted out type of alert. High opt-out rates for Amber could significantly hinder authorities' ability to locate missing children. And there was substantial local variation in opt-out rates, with notable effects at state borders, indicating different state policies and practices. States should also weigh the cost of alert fatigue against the benefits of wider reach that statewide alerting provides. Recommendations here are, IPAWS might engage with state and local originators, as well as the National Center for Missing and Exploited Children, to understand and improve the effectiveness of Amber Alert policy. They might also augment public awareness campaigns to emphasize the importance of opting into Amber Alerts, and also provide Amber Alert originators with training and access to tools that enable more precise geo-targeting of messages. Next slide. WEA does reach people with disabilities at similar rates to those without disabilities. And as Andy mentioned, that's an encouraging result. However, further studies are needed to gain more detailed insights. This study did not assess whether WEA messages are technically accessible to people with disabilities, such as considerations for font size, contrast, text-to-speech features, and plain language. Recommendations might include IPAWS should conduct further research on the functional needs of individuals with disabilities and engage individuals with disabilities in both qualitative and quantitative studies to better understand and address their specific needs regarding WEA message accessibility. Next slide. Our report highlights the necessity for continuous testing, evaluation of WEA's reach to ensure its effectiveness. This is the first representative national survey conducted by IPAWS since the rollout of WEA in 2012, establishing a flexible and ongoing capacity to assess WEA reach would enable the evaluation of both test alerts and real-world alerts and warnings, as well as track actual protective actions that are taken by the public during these events. Ongoing testing and evaluation of reach would complement the efforts that are already happening within the engineered portions of the WEA system. Next slide. And finally, collaboration and coordination among federal, state, and local government agencies, along with private sector partners such as wireless carriers, mobile technology companies, are essential for the success of the WEA system. The report indicates that receipt, awareness, and opt-out of WEA messages varied across different carriers, mobile device brands, and mobile WEA capabilities. And this variation underscores the significant role these entities can play in enhancing WEA outcomes. Improved coordination among stakeholders has the potential to mitigate the issue of over-alerting, which can influence opt-out rates ultimately. IPAWS might consider alternative approaches, but it might just be about persistence in the efforts to coordinate with both government and private partners to enhance WEA outcomes, addressing those various factors that we've identified in the report. Next slide, please. So we are now moving into some Q&A, but I want to thank everyone for the opportunity to share our work with you today. And we are opening the floor for questions. You can drop those questions in the Q&A box, and Jason will be moderating those for us. But thank you again for your time and attention today.
Well, first off, thank you, Andy and Rachel, for just the fantastic presentation on this really interesting work. As Rachel said, please feel free to. There's the Q&A portion, so everyone should just feel free to enter any questions they have in the Q&A function on Zoom. And I see there's a few in there, but while folks put in some questions, other questions, I'm just going to get things started. So many interesting things with this work we could ask about and discuss, but maybe I'd like to start with a couple kind of big picture questions. So one of the things I found kind of very interesting in reading through this work and hearing your presentation is that, WEA has been around for about 12 years, from what I understand. This is the first survey of WEA alerts and kind of their effectiveness, and first study of this kind. Could you talk a little bit about that? Are there some unique challenges to fielding a survey like this? What have been some of the difficulties that made doing something like this such a challenge for so long?
Yeah, it is interesting that this hasn't been done before. There have been surveys around WEA, but not a systematic, a large scale effort like this, and one that particularly follows something like the national tests that we saw. One issue with that is that the national tests are very rare. There are plans to make them more regular, but at the moment, or at least some discussion about making them more regular, but there's only been a national test that has actually gone out to the public once before. in the history of WEA. So there haven't been a lot of opportunities to do it precisely this. One of the features of WEA that I mentioned at the beginning is that it is a one-way communication to the phones. There is no return signal from the phones. If you send a normal text, this is unlike a normal text message. If you send a text message or you receive a text message, the phone responds to the cell tower that it received it. That doesn't happen with WEA, and that keeps down the bandwidth and the drain on the system in a time of emergency. But it also means that iPaws can track the progress of the alert all the way through the engineered system, right up until the cell tower broadcasts it. But iPaws doesn't have insight directly into data on whether or not the phones that receive it. That's why we did this in a survey, was so that we could get some direct evidence on this. There are other challenges, bureaucratic challenges, to doing large-scale data collection from the public, particularly anytime you request information from the public, the federal government does. It has to have that data collection reviewed by the Office of Management and the Budget under the Paperwork Reduction Act, which is a fairly substantial review process, and we had to go through that, and that actually added quite a bit of time to the timeline of this project. But IPAWS has expressed, and FEMA has expressed a distinct interest in continuing to do this kind of data collection moving forward.
I think I'd like to add just one additional challenge, if I may. I think one challenge too is, when you're interested in something like geographic variation, it necessitates this huge sample size, and trying to do that using only probability samples just actually wasn't possible. So going to everyone and trying to get the right sample size using the statistical sampling design that we were looking for, just even that was a challenge. But we do have a lot of recommendations and maybe lessons learned there. So for folks that are trying to do large scale surveys for other research areas or areas related to WEA, we would be happy to share those lessons learned.
Thank you. I'm curious, were there some topics or questions you'd hope to explore through this analysis but weren't able to due to these various challenges?
Mine's quick, Andy, and this is one we discuss all the time, but we weren't able to ask questions around trust in the system. And I think that was the big one, that when you think about, any survey you've done and what questions you would have wanted to ask and couldn't, trust is always the biggest one that comes up for our team, and one that we would be interested in delving into in a next iteration.
I agree with that. I would also add, because this was a survey about a test alert, we weren't able to dive into people's behavior or willingness to engage in suggested action. Like, imagine doing something like this when they've been asked to shelter in place or evacuate or do other things. Following up on that, it would be very interesting to know to what extent did they actually engage in those behaviors. With a test alert, that's just there's no behavioral ask there, so we weren't able to do that. One of the things we'd like to explore looking in the future is getting at some of these downstream behavioral effects. I will say one of the things that surprised me was the vast majority of people who started a survey finished it. One concern about any survey like this is that the longer it gets, the more burdensome it gets, the more people are going to stop responding. And we just didn't see this. It was a short survey, about 5 minutes long, but it does suggest that there is some room for adding, in future surveys, adding more content.
Thank you. Just like to remind folks, please feel free to stick any questions you want in the Q&A function. So another question, then I will turn to some of the Q&A questions that have been posed. Another, I think, the really striking finding, to me anyway, concerns the Amber Alerts and the opt-out and the concerns about alert fatigue. I was wondering, could you talk a little more expansively about this? Do we have to worry about fatigue in other areas, like in jurisdictions or states where they have high hazards and they may see kind of a great frequency of alerts. Was there any evidence of that so far, or any reason to think that might be a concern?
Yeah, I think I might say in summary that it's not necessarily that the sheer amount of alerts you're receiving equates to fatigue. It's a complex layering of whether you think the information is relevant, if it's relevant to your area, if it's relevant to your situation. And we did control for natural hazard in the study. So there wasn't as much evidence that just because you receive more natural hazards and therefore potentially more alerting that leads to higher fatigue. In this case, the Amber Alert results specifically did have a strong relationship to the states that had a history of statewide alerting, which is why we honed in on, we weren't picking on Texas. It was just, an eye-popping result. And that happening at the state level for a state that large was particularly notable for this. But Andy, do you have other points to expand on that?
Getting back to the prior question, even, I think we asked people had they opted out, and whether, and if so, what types of alerts have they opted out of. What we didn't ask them is why. And getting at some of that reasoning for it would be very it would also be very interesting to ask questions about how much they see the system as relevant to them in their lives. Because we might be able to get at some mechanisms here for why are folks opting out or not. What are the factors that are associated with that?
Thank you. I see in our Q&A, we do have a question from Zach Stanford, and he, building on kind of in this vein, he asked, are there any correlations to those who opt out of all alerts during a specific opt-out? And for example, he asks, is someone who opts out of an Amber Alert only, are they also more likely to opt out of alerts of other types?
Did we run, Andy, that you recall, within answer correlations, whether there was higher opt-out?
I was just thinking about that, and I don't think we actually did correlate with somebody who said they opted out of Amber also would say they opted out of something else, and what the correlations are there. One of the things we did see in analyses that are in the report is that those individuals who had experienced more Amber Alerts or were lived in areas that had historically more Amber Alerts were more likely to opt out of Amber by a substantial margin. They were also more likely to opt out of imminent threat alerts or other types of alerts, and by a somewhat lower margin. So I think that what was equally interesting is that, as if I recall it correctly, folks who had experienced other types of alerting, that had an effect on opting out of for say imminent threat alerts, but less so on Amber. So there does seem to be some spillover effect there. This doesn't directly address the question that was posed. I agree with Rachel. That's analysis we haven't done but could do. But there are there do appear to be some relationships amongst these, as well as some sort of lane specific effects.
Thank you. Just to again remind the audience, please feel free to enter any questions into Q&A. We'd love to hear what you'd like to ask about. A few more questions. Well, hopefully some folks have their own. Another thing, during this administration, FEMA has really placed the strategic focus on tribes and really made this a bit more of a priority. They talk about in their strategic plan and a lot of their planning documents. I was curious to what extent did this study touch on that subject, and what did you find with regard to tribes?
Well, as folks saw in the description of the methodology, there were some explicit points that we incorporated tribal nations and indigenous populations in our analysis. We knew that this was an issue that was been expressed to us of interest to FEMA. So we we used the sort of vast resources of the non-probability survey vendor that we used who in principle has access to millions of people to oversample rural areas, but also to oversample areas that had higher indigenous concentration of either indigenous land or indigenous population, as reflected in the census and other federal databases. So we basically looked for counties that had relatively high concentrations of either of those, and oversampled those. So we actually made sure that we had a reasonable sample of folks from those areas. The reasoning behind that is we as a place-based system. There's and so while it is often very difficult to get substantial indigenous participation in surveys because it's a relatively small portion of the population and other factors, it is in many ways it was sufficient for us to know, is the system, how well is the system working in the areas where these populations live. So that was one of the explicit strategies. We also incorporated that indicator, or the indicator of that sampling or design into our regression analyses, into our statistical analyses. By and large, there were not large effects for this. So the positive view of this is that it's reassuring. We're not seeing that the system is working less well or better in those regions compared to other regions. We also have a variable, a self-report variable in our demographic portion of the survey that was about race and ethnicity, and so looking at that, we also did not see strong effects there. I will say something I said earlier. We have as I said, we have a very, very large sample here, which gives us a lot of statistical power. So if in many ways, what's almost more surprising here are when things are not significant, because it's we have a lot of power to detect even subtle effects.
Thank you.
And I want to mention too, before we move on from that question, this is where, we were using a proxy for potential receipt and awareness in these place-based areas with higher indigenous concentrations, but questions along the lines of trust and utility of the system, particularly in these sorts of populations, are of a big interest to IPAWS and FEMA at large. And so these are things that can be drawn on and drawn out in future iterations of surveys. And whether surveys are even the appropriate method for trying to learn more about these populations.
Thank you. That's a great point, Rachel. Appreciate that. Thank you. Well, I'd be curious to ask, what was most surprising to you in this work? What for me, hearing about the Amber Alerts was something I never would have expected. But I'm going to guess a lot of other people feel the same way. I was kind of curious for you having been in the weeds in this and working on this for quite some time. What surprised you when you got to the results?
I have one. It's kind of what Andy was touching on at the end, which is the things that weren't popping out in the analysis or had a large effect size that we were kind of going in thinking. We tried not to have, a bias going in of what we might see, but just trying to control for all the different factors related to communities and previous natural hazards, et cetera, and all the characteristics we controlled for. The fact that things didn't pop up as, driving receipt or awareness or opting out, and it might also be a function of the outcomes that we were looking at in particular. But, things like those with disabilities not receiving alerts at a lower rate than other groups was particularly interesting to me. And I know this is an area not only for FEMA, but also our group wanting to understand a bit more about the functional needs of different individuals with varying levels of, these were self-reported disabilities. And so I think that was something that was pretty surprising for me, but overall a good thing. We're going in the right direction, it sounds like, but much more research to be done. Research for more research.
What this is a small thing, and it's more of a methodological point than it is a it may be a substantive point. We gave people the option to take the survey in either English or Spanish. Those are the two languages that we as operational the options in it for WEA alerts. We had a Spanish survey and an English survey, and we let people choose which one they wanted to take. We also asked people what languages were primarily spoken at home. We found that even amongst individuals who Spanish is primarily spoken at home, many of them chose to take the English language survey. It serves to indicate just, you know, how complex that issue actually can be. You can have somebody who grew up and lives in a primarily Spanish-speaking household, but their preference outside the household is to speak in English or read in English. And so language is something that is in very much in discussion with FEMA and the FCC surrounding WEA alerts, expansion to other languages, particularly for regional effects or regional surveys. You know, this was a national survey, but in some areas of the country, you know, non-English speakers are much more concentrated. This is something that is a big interest to them. When going out and collecting data like this, however, giving people the option to respond in the way they would prefer would seem like it's a good idea.
Thank you. Well, I'm curious, you know, this work was done for FEMA. So what was there? Were there any things that surprised them to get out of this?
They are, I think like as we discussed here, a lot of the attention has been on the opting out. There is a the variation across the country, I think, caught them a little by surprise. It wasn't necessarily a surprise to everyone that opting out was an issue in Texas, for example, because they have heard anecdotal reports that just how annoying some of it can be. But to see it demonstrated in the data and as dramatically as it was, I think did catch their attention. There are some other aspects that we didn't talk about here today in the survey about sort of the situational, contextual situation the person was in at the time of the alert in terms of their phone use, like were they using the phone, were they, you know, but one of the questions that was asked was, did you receive the alert multiple times? And they're very involved, this office at FEMA is very involved in the technical system here. And so there are a lot of those sort of nuts and bolts type of experiential questions that they were very interested in as well. They are, of course, very interested in equity. And the equity related results were some of the ones that we've discussed at most length.
Great summary, Andy. And I'll just add that I remember the first time we briefed this with this FEMA office, we brought up the statistics on nationwide receipt, and we're like 91% of people reported getting the test alert, and the response was, well, what about the 10%? Right? Like there's a need and a desire to understand more about the 10% and who they are, what their characteristics are, where they are. So there's definitely a desire in this FEMA office to understand the 10% better and give themselves a pat on the back, which they should, you know, but also there's a strong desire to understand how can we do better for that 10%.
Great. Thank you.
Just one more thing following up on that. If there was you mentioned that this is the first time they've done this. I think the first thing we saw when we started sharing results with them was they started to have more and more ideas and questions of what they would like to ask in the future. It really drove an interest in what had previously been a relatively black box for them.
That's really interesting. Thank you. Are there any indications that this work may lead to some changes in how the program is administered, or is it kind of too early and everyone's kind of digesting the work and trying to figure out what to make of it?
I do think it's pretty early in if for that right now. They are definitely digesting what was a fairly substantial report. I There's a big discussion of what comes next in terms of what are their needs, and how can these data themselves and any future data help them solve problems that they know they have. But I think you know, we will be seeing soon, I think, sort of how they plan to act on what was in the report.
And a logistical note for those that do not want to traverse the large report, it's a treasure trove for the methodologists, the research community, for the nuts and bolts, the nitty gritty of how we've done this over the many years that this project has been going on. But we are providing an executive summary. I believe that's on the web. Is it on the website? Yep. I want to make sure people that maybe don't want to get into the gory details, but want sort of a summary of the major points and implications of this work. We did provide a much shorter executive summary, not only for you to enjoy, but to pass along to your friends and researchers in the practice and in the community, for anyone that this might be useful for.
I do see there's another question in the queue, and from Dennis Gusty, and I just wanted to address it real briefly. The question asked is Texas, since Texas has a higher than normal amount of Amber Alerts, could that indicate that there are a higher frequency of child abductions in Texas? And were the results shared with Texas, and do Amber Alerts lead to children that are abducted being rescued? Certainly some of this is outside the scope of this project, but let me try to dive into this because I think it's an important issue. Texas is a very large state, so if abductions happen at a sort of standard rate across the country, you'd expect that Texas would get a disproportionate number of them just because it's such a large chunk of the population in the land area. We did not bring in data on actual child abductions into our analysis, but that's an excellent question to ask, and something that presumably could be done, based on the availability of those data. We do know that in prior conversations, folks from Texas have been on some of the calls. And Amber Alerts are seen as a critical tool in the toolbox for finding and rescuing children who are abducted or simply lost. So this is an important policy issue. One of the things you definitely see when you look at the map of historical Amber Alerts across the country using WEA is that if you map out the regions that those alerts went to, in much of the country, it's fairly granular, but in certain states, it definitely follows state boundaries. Texas, New Mexico, Florida, some other states that we mentioned earlier, have had this practice at one point or another. And those policies of broadcasting to an entire state as opposed to a smaller geographic region, and also stopping it at the state line, the relevant area may extend beyond a state boundary. Those are the kinds of things I think that deserve to take another look. We take at those policies.
Thank you, Andy. I see we do have another question from Zach Stanford. Kind of another question about the correlations between Amber Alerts and other things. So his question is there any correlation, maybe not surveyed, on opt-outs for imminent threat alerts in areas that issue non-Amber missing person alerts? Did you have a chance to look at that at all?
I'm reading this and digesting
You certainly have
whether
not
I understand the question. No.
Yeah, I think so one of the aspects of the data we've been using that I've alluded to, but haven't explicitly said, is that there's a database of historical alerts that have been sent around the country, including the types of alerts, where they were sent, the sort of geographic area they were sent to, et cetera. This is available on the Open FEMA data repository, and we used that to extract rates of alerts, historical rates of alerts in different geographic areas. One of the we necessarily aggregated up to fairly large categories of alerts, based on the research questions we were focused on, but there are some opportunities for more granular types of alerts. It sounds like there's going to be a new alert type coming out, and it seems like that would be a good opportunity to revisit those data with a specific eye towards, are there any lessons learned from historical alerting that could feed into this. One thing that we did note: Amber alerts are not applied uniformly or originated uniformly across the country. The National Center for Missing and Exploited Children is the originator for many Amber alerts, but in specific regions of the country. Some regions, they're not the primary originator. We have not, at this point, had the opportunity to delve into what's behind all of that. But there is there may be different players involved. There certainly are different policies. That's pretty evident in the data.
Thank you, Andy. All right, we just have a couple minutes left, so maybe I'll ask one last question, and then we can wrap this up. So you've kind of alluded to this, I think, throughout the discussion, but I'd like to hear a little bit more, if you wouldn't mind, about what research is needed next in this era. Where do you see the future needs are?
I have some interest and see some need in, as I said, digging in on those with disabilities a bit more, but also doing some critical looks at the issue of over and potentially under alerting. We started to dabble in some of this within this project as sort of a side thing, but it would be great to ramp that up a bit more. It is a weather-based understanding of where you might expect under or over alerting based on the incidence of, say, tornadoes and severe weather events. So I think there's a lot more granular work to be done on this issue of over and under alerting and how we're defining that, because that's going to be very place-based and person specific and people's risk tolerance. And so this isn't something that you can do with, one great quantitative analysis geographically. That's one component of it, right, on potential over and under alerting. But there's a lot of work in this space and making sure that things like WEA remain, relevant to folks, and potentially that would impact the opt-out rate if folks are seeing that it's relevant to them. I know growing up in Tornado Alley, we didn't always see, a tornado warning as over alerting. It was more seen as a near miss, and we still valued getting that warning. So it's not a one-to-one. So I think there's a lot that's already been done in this space, and I think there's still a lot of work to be done.
Well, thank you, Rachel. Andy,
from my perspective, I'd love to dig more. I'm a psychologist by training. I'd love to dig more into the psychology of this. Some of the things I mentioned earlier, and Rachel mentioned earlier, trust in the system, understanding of the system, perceived risk of the hazards that are being the alerts are about, willingness to engage in protective action that is recommended in the alerts. These are all sort of getting into what I consider sort of the next step of understanding here, which is how can we understand how people are thinking about their own protective behavior or not, and how can we use that to inform communications or structure of the system.
Well, with that, thank you. Thank you, Andy and Rachel, for the great work that you've done in a really interesting discussion. We really appreciate it all. And thank you, the audience, for joining us, and have a good day.
Thanks, everybody.
Thank you.